All right, welcome everyone. Ready for a deep dive into Plano Therapeutico Singular.
PTS, definitely.
PTS it is. We've got your stack of resources, articles, guides, official documents, the works. And your goal is to really get this right, to make a training course for your hospital staff.
Yeah, it's ambitious.
Ambitious,
But it's really key. It's at the heart of good patient care, especially in a system as complex as the SUS in Brazil.
Absolutely. So we're not just going to, skim the surface here. We're going to get into the what and the why. Why is PTS so important? How does it actually work in practice? And what are those nuances that you're really going to need to get across in your training? One thing that jumped out at me when I was looking at your materials was this program in Brazil where patients can get IV antibiotics at home.
Oh, you're talking about OPI. Yeah, that's a perfect example of how PTS kind of goes beyond just the walls of the hospital. We can definitely dig into that and talk about, whether it actually improves outcomes or if there are any trade-offs or, kind of pros and cons to that.
Right.
But first, let's make sure we're all on the same page about what PTS actually is.
Okay, so back to basics. We're talking about personalized care, right?
Yeah.
But what makes it different from just a doctor, giving instructions?
Well, it is personalized, but PTS is so much more than just a set of instructions. It's a plan that's created with the patient, not just for them.
Oh, interesting.
And it takes into account their whole life, not just the illness, right? So we're looking at their physical needs, their emotional state. What kind of social support do they have? Even cultural beliefs that might affect how they approach their care. And it's a living document, It evolves as the patient's needs change.
So it's really not just about the disease, it's about the person. That's a really important distinction, I think. And it sounds like it takes a whole team to really pull this off.
Oh, absolutely.
Yeah.
PTS relies very, very heavily on this concept of interdisciplinarity. We're talking doctors, nurses, social workers, psychologists, nutritionists, physiotherapists, you name it. This whole range of professionals working together, that's going to be a key element of your training, emphasizing that collaborative approach.
Absolutely.
Yeah.
One of the articles you sent had a really great example about a heart attack patient.
Yeah.
And they talked about how each professional had a specific role to play in their PTS. The doctor managed medications, the nurse provided education, the nutritionist helped with diet changes. It was amazing how it all kind of came together.
Yeah, and of course you can't forget the physiotherapist, right? For rehab, the psychologist for emotional support, and even the social worker connecting the patient to resources out in the community. It really is a team effort. But crucially, the patient is at the center, right? They're actively involved in their own care.
Okay, so I see how this aligns really well with the holistic care approach of SUS. But when it comes to actually, creating a PTS, where do you even start? Is there like a step-by-step process?
Oh, absolutely. There are 4 distinct stages that we go through. The first and arguably the most important one is diagnosis. But in PTS, diagnosis is more than just identifying the disease.
Right. So it's not just what's wrong, but who is this person? What else is going on in their life that might impact their care?
Exactly. So what's their social support network like? Are they dealing with any financial stress? Do they have cultural beliefs that might affect how they approach their treatment? All of these things get considered in the PTS diagnosis.
Wow. So you're really getting a complete picture of this individual. It's almost like detective work.
That's a good way to put it.
Okay. So once you have that thorough diagnosis, what's next?
Well, then comes the goals stage.
Yeah.
And this is probably the most empowering for the patient, right?
Yeah.
What does the patient themselves want to achieve? And again, we're thinking beyond just curing the disease.
So it could be like regaining enough mobility to play with their grandkids or managing their anxieties so that they can return to work. Like goals that are really meaningful to them personally.
Perfect examples. PTS encourages setting short-term, medium-term, and long-term goals, all tailored to the patient's own aspirations and possibilities, right? So, it gives them that ownership over their recovery.
Yeah.
This is a stage where in your training, you'll want to really highlight the importance of the patient's voice.
Right. So we've got diagnoses, we've got goals. Now we got to figure out how to actually make it happen.
Yeah, right. And that's where the third stage comes in.
Yeah.
The action plan. This is where the rubber meets the road,
Yeah.
It outlines the specific interventions that are needed, who's responsible for what, and realistic timelines for everything.
So let's say the goal is to manage diabetes. The action plan might include things like regular blood sugar monitoring,
Yeah.
medication management by the doctor, nutritional counseling, maybe even joining a support group. Like it gets very concrete at this point.
Precisely.
Yeah.
But you also have to remember that PTS is not, set in stone. Life happens, things change. The plan needs to be flexible enough to adapt.
Which brings it to the fourth and final stage, right? Evaluation and reevaluation.
Yes.
I can see how this is just vital for keeping the plan, relevant and effective over time.
Yeah. Absolutely. So PTS requires these regular check-ins to see what's working, what needs tweaking, and if the patient's goals are being met. Maybe a new medication has some side effects or their personal situation changes. The plan needs to be able to, to adjust to that.
So it's a constant process of refinement and collaboration between the patient and the whole care team.
Yeah.
Really a dynamic approach to healthcare.
And speaking of the care team, let's dive a bit deeper into who the key players are in PTS and what their roles actually are. This will be essential information for your training.
Yeah. This is where it starts to get really practical for designing the course. We know it's not just doctors, right?
Of course not.
Our sources highlighted a whole team of people involved.
Yeah, we've mentioned several already, but let's be specific. The core team usually includes doctors, nurses, social workers, psychologists, nutritionists, physiotherapists, but, and this is really crucial for your training to emphasize, the most important member of that team is the patient themselves.
Right. It's about empowering them to be an active participant in their care, not just a passive recipient of treatment. That's a big shift in thinking, I think, for a lot of healthcare professionals.
It is. Now, to really solidify this for your training, let's look at a specific example. Imagine a patient who's recovering from a stroke. Each professional is going to contribute their unique expertise to create a truly personalized plan.
Okay, so the doctor would manage medications and order tests to understand the impact of the stroke, but it goes so much further than that, right?
Oh yeah, the nurse would be educating the patient and their family about stroke recovery, monitoring vital signs, helping them with daily activities. And then you've got the physiotherapist who would be crucial in helping them regain mobility and independence.
And the psychologist would be providing emotional support as the patient's adjusting to life after the stroke. And the social worker would be connecting them with resources and support groups and maybe even financial assistance.
Excellent. You see, it truly is a team effort. And each professional is playing this really vital role in the patient's overall well-being.
And the patient, empowered by the PTS process, is at the center of it all. This is starting to paint a clear picture for me of how I might structure the training.
Good.
But, our sources also highlighted some challenges in implementing PTS. Are there any in particular that you think are important for my audience to understand?
Oh, well, you're right. Putting PTS into practice, it's not always a smooth journey. One common obstacle that comes up is making sure everyone on the team is talking to each other,
Yeah.
and working together towards the same goals. Because it's easy for things to get lost, especially in a busy hospital.
Yeah, exactly. And one of the sources that you shared mentioned using something called Kanban.
Yes.
To help with that. It's a visual management tool, right?
Yes, Kanban is a fantastic way to improve communication and just the visibility of the workflow. It actually originated in manufacturing.
Oh, interesting.
But it's been adapted to healthcare. And it works really well.
Yeah.
In the context of PTS, imagine you have this big board, right?
Yeah.
With color-coded cards that represent each patient and their stage in the process. It's a very, very visual way to keep everyone on the same page. Prioritize tasks, see any potential bottlenecks.
It's such a helpful visual. I can already see myself incorporating that into the training. It's a great way to illustrate the importance of teamwork, and coordination in PTS.
Yeah.
What about the challenge of motivating patient participation?
Oh, that's a huge one, yeah.
I imagine that could be a hurdle as well.
Yeah. Oh, absolutely. Patient buy-in is essential for this to work. You'll get some folks that are hesitant to take an active role, or maybe they don't fully understand what's expected of them. The key there is communication, education, and really listening to what the patient's concerns are.
It's about building that trust and rapport.
Mm-hmm.
And making them feel like they're a partner in this journey.
Exactly.
But what about when resources are limited? That's a reality,
Yeah.
right? For a lot of hospitals, especially those operating within the SUS.
That's a valid concern, and that's where the creativity really comes into play. You know, it's important to highlight in your training that PTS can be adapted, you know, to overcome these limitations.
Right.
Your materials had some inspiring examples of how Brazil's tackling this. Take EMAD, for instance, which utilizes home-based care teams to provide support for patients with more complex needs.
Right. So EMAD allows patients to receive that care in the comfort of their own homes, which, reduces the need for those costly hospital stays. And there's OPAT, which we touched on earlier.
Right.
That allows patients to receive, intravenous antibiotics at home.
Exactly. These are just a couple of examples, right, of how PTS can be tailored to fit different contexts. You know, it's about being resourceful, finding those innovative solutions that prioritize patient well-being while still acknowledging those budgetary realities.
Yeah.
And this is a really important point, I think, for your training audience.
Right.
It shows them that PTS isn't this rigid system. It's a flexible framework
Right.
that can be adapted to different realities.
Yeah. Yeah. That's a great point. It'll help them see, how they can apply these PTS principles in their own unique hospital setting. Now, we've talked a lot about PTS on this kind of micro level, right? Focusing on the individual patient and their care team. But I'm curious, how does PTS fit into the bigger picture of Brazilian healthcare?
That's a crucial part of understanding its impact.
Yeah.
Let's start by connecting it back to the principles of SUS, the Brazilian public healthcare system. SUS is built on this foundation of universal access to healthcare, right? And it emphasizes holistic and humanized care.
And PTS aligns perfectly with that, right?
Yeah.
By focusing on these personalized care plans, PTS helps ensure that each patient receives, the most appropriate and effective treatment for their unique situation. It's about tailoring the care to the individual, not the other way around.
Exactly. And this focus on individual needs also helps to reduce unnecessary hospital stays, which is another key goal of SUS. Right. So PTS empowers patients to manage their health more effectively outside of the hospital, which then frees up those valuable resources for people who really need acute care.
It's a win-win,
Yes,
really, for both the patients and the healthcare system as a whole. Now, our sources mentioned several other Brazilian healthcare initiatives that work in conjunction with PTS. Can we explore those a bit further?
Absolutely.
It would be helpful for my audience to understand, how PTS connects with these other programs.
Right. Well, one important initiative is NAQH, Núcleo de Acesso à Qualidade Hospitalar.
Well,
This program works to streamline access to specialized care and services. Imagine you have a patient with a complex condition who needs a specific type of therapy or diagnostic test.
Yeah.
Right. NAQH helps to ensure that they get that access quickly and efficiently. And that is just, vital for successful PTS implementation.
So NAQH is kind of like paving the way, for PTS to be truly effective.
Yeah.
What about other initiatives?
Well, we already discussed EMADED, which provides that home-based care, but there are also numerous specialized programs that integrate with PTS. For instance, Polos de Curativos, which are wound care centers, offer expert care for patients with chronic wounds.
Right, and there are programs specifically designed to support patients with colostomies. Providing them with education and supplies and emotional support. All these specialized services can be incorporated into a patient's PTS, right?
Absolutely.
Ensuring they receive that comprehensive and coordinated care. It's like a safety net woven around them, offering support from all angles.
That's a great way to put it. And this network of support is especially important, for patients with chronic conditions or those recovering from serious illnesses. It's about making sure that they have access to the right resources at the right time throughout their entire healthcare journey. Now, before we move on, I think it's important to touch on a concept that's closely related to PTS and particularly relevant for your training. Alter Responsab.
Oh, yes, that stood out to me as well.
Yeah.
It's about ensuring that hospital discharges are well planned and coordinated so patients have the support they need to continue their recovery at home. It seems especially crucial for patients with complex needs or those who might be at risk of readmission, right?
Exactly. Alter Response Level goes beyond just, handing the patient discharge papers and sending them on their way. Right. It involves careful planning, communication between the hospital team and the patient's primary care provider.
Yeah.
And making sure that they have access to everything they need, whether it's, home health care services, support groups, you name it. Think of it as the bridge, right?
Yeah.
Between the hospital and the patient's life outside.
One of the sources mentioned that in the U.S., around 20% of patients end up back in the hospital within a month of being discharged.
Wow.
That's a staggering statistic.
Yeah.
It really highlights the need for a solid discharge plan.
Absolutely. And Alter Responsible can play a significant role in reducing those readmissions. It's about setting patients up for success, not just sending them out the door and hoping for the best.
So how does Alter Responsible tie into PTS specifically? I'm starting to see the connection, but I want to make sure I understand it clearly for the training.
Sure. Well, it's all part of a continuum of care, right? The PTS, which is developed during the hospital stay, lays the foundation for a smooth transition, back home.
Right.
It outlines, the patient's goals, what needs to happen to achieve those goals, and who will be responsible for making those things happen once the patient is discharged. Alter Response Level takes those plans, right? And puts them into action, ensuring that continuity of care beyond the hospital walls.
I see. So it's like passing the baton in a relay race.
That's a perfect analogy.
The hospital team hands off the care plan to the patient support system.
Yeah.
And Alter Responsible makes sure that transition is smooth.
Yeah.
And the patient doesn't miss a beat in their recovery.
Exactly. And this brings us back to the importance of the entire care team working together, seamlessly. PTS is not just about what happens within the hospital. It's about creating that comprehensive support system that extends into their life outside.
Yeah, that makes a lot of sense. So we've talked about these big picture initiatives like NAQH and EMAD, and we've explored this concept of Alter Responsible.
Right.
But what about the more practical hands-on tools that healthcare professionals use to actually implement PTS day to day?
Yeah.
We touched on Kanban earlier, but are there any other tools or strategies that you think are important for my audience to be aware of?
You're right. Those practical tools are essential, for actually making PTS a reality. And aside from Kanban, which is excellent for visual management and workflow, there's another key area that you'll want to include in your training: education en salud.
Right.
Or health education.
Right. That makes sense. Knowledge is power.
Right.
And empowering patients to understand their own health conditions is crucial for them to actively participate in PTS.
Exactly.
Yeah.
Health education is all about giving patients the information and the tools they need to be active participants, not just passive recipients of treatment.
Right.
This could involve, providing clear information about their diagnosis, medications, treatment plans, really anything that helps them to understand what's going on with their bodies and what they can do to improve their health.
So it's not just about, giving them a pamphlet or lecturing at them.
Right.
It's about truly engaging them in the learning process.
Exactly.
And making sure they feel confident in their ability to manage their own health.
And this can take many forms. It could be one-on-one conversations. It could be group education sessions, providing access to reliable online resources, or even connecting them with support groups where they can learn from others who are going through similar experiences.
I'm starting to see how all these pieces fit together.
Mm-hmm.
You have these big picture initiatives like NAQH and EMAD.
Yeah.
You have the practical tools like Kanban and health education, and you have this overarching framework of PTS guiding everything. It's quite a comprehensive approach to healthcare.
It is, and to really bring it to life for your training, it might be helpful to delve into some specific examples, right, of how PTS can be applied in different hospital settings. Let's start with a common scenario. A patient with a chronic condition like diabetes.
Okay. That's a great example because diabetes management is is so multifaceted.
It is, yeah.
It's not just about taking medication. It's about lifestyle changes. It's about monitoring blood sugar levels, attending regular checkups. It requires a lot of self-management and active participation from the patient.
Exactly. So a PTS for a patient with diabetes would begin with a thorough assessment of their current health status. This includes their blood sugar control, any complications they might have, their understanding of the disease, their current lifestyle habits. Then the team would work with the patient, right?
Yeah.
To set realistic and meaningful goals. Remember, patient involvement is key.
Right. So these goals might include things like reaching a target blood sugar range, learning how to give themselves insulin injections, or making dietary changes to better manage their condition. The goals need to be specific, measurable, achievable, relevant, and time-bound, that SMART goals framework.
That's a great point. Using those established frameworks like SMART goals can be really, really beneficial for both the care team and the patient.
Yeah.
It really helps to create that roadmap for success. Once the goals are established, the action plan comes next, outlining the specific steps that are needed to achieve them.
So this might include, regular appointments with the doctor to adjust medications, consultations with a nutritionist to create a personalized meal plan, sessions with a diabetes educator to learn self-management techniques like blood sugar monitoring or recognizing signs of low or high blood sugar.
And it could also involve, connecting the patient with support groups, either in person or online, where they can connect with others that are living with diabetes and share experiences and strategies. It's about building that whole network of support around the patient.
Right. And of course, regular evaluation and reevaluation would be essential.
Of course.
To make sure that the plan's working and adapted as needed. Diabetes it's a dynamic condition, and the PTS needs to be flexible enough to accommodate changes in the patient's health status, lifestyle, or personal circumstances.
Yeah. Now, shifting gears a bit, let's consider how PTS might be applied in the case of a patient recovering from a stroke.
Okay.
Right. This is another scenario where a multidisciplinary approach is just absolutely essential.
Yeah. Yeah. Stroke recovery can be a long and challenging process, requiring input from a whole range of professionals. I imagine the PTS team in this case would include a neurologist to manage the medical aspects, a physiatrist to oversee rehabilitation, a physical therapist to help regain mobility, an occupational therapist to assist with daily living activities.
And don't forget the speech therapist, right? If the stroke has affected the patient's ability to communicate, and of course the nurse to provide that ongoing care and monitoring. And just like with diabetes, the social worker would play a vital role in connecting the patient and their family with community resources and support networks.
Yeah, it's truly a team effort. And the goals in this case might focus on regaining as much independence as possible, improving communication skills, and adapting to any physical limitations resulting from the stroke.
The action plan would outline those specific interventions that are needed to achieve those goals, such as intensive physical therapy sessions, speech therapy, occupational therapy, and even psychological support to help the patient cope with the emotional and mental challenges of stroke recovery.
And throughout the entire process, the patient is at the center of the PTS, making decisions, expressing their needs, and actively participating in their own care.
Exactly. Now, before we move on to the final part of our deep dive, I want to touch on one more area where PTS can be incredibly valuable: mental health care.
Right.
Mental health conditions are often they're multifaceted, and they require this holistic approach that addresses not just the symptoms, but also those underlying social, emotional, and behavioral factors that contribute to the condition.
Yeah, that's a really important point. Mental health is often, overlooked in traditional healthcare settings.
Absolutely.
But it's an essential part of overall well-being. I'm curious to hear how PTS can be applied in this context.
Well, PTS for a patient with a mental health condition might involve a combination of therapy, medication management, and lifestyle changes. For example, imagine a patient with depression.
Okay, so they might benefit from individual therapy sessions, to explore their thoughts and feelings, as well as group therapy to connect with others who are going through similar experiences.
Yes, and a psychiatrist might prescribe medication to help manage the chemical imbalances that often contribute to depression. Additionally, lifestyle changes like regular exercise, a healthy diet, and stress management techniques can play a huge role in improving mood and overall well-being.
And all of those elements, therapy, medication, lifestyle changes, would be incorporated into the patient's PTS, right? With clear goals and an action plan outlining the specifics of each intervention and regular evaluations to ensure the plan is meeting the patient's needs.
Precisely. Mental health care is often a journey.
Yeah.
And PTS provides that roadmap for that journey, guiding both the patient and the care team towards, recovery and a better quality of life.
This is all incredibly valuable information for my training. It's really highlighting the breadth and depth of a PTS and how it can be applied in so many different contexts within the hospital setting.
I'm glad to hear that. We've covered a lot of ground in this section, exploring how PTS connects with other Brazilian healthcare initiatives,
right?
Examining those practical tools like Kanban and health education, and looking at specific examples of how PTS can be applied to chronic conditions, complex recoveries like stroke, and even mental health care.
Yeah, it's clear that PTS is a comprehensive and dynamic approach to healthcare, one that has potential to truly transform patient care and outcomes. But before we wrap up this deep dive, I think there's one more crucial aspect we need to address. We've talked a lot about the how of PTS, the practical steps, the teamwork, the tools. But for my audience, especially as they're designing this training, understanding the deeper why is crucial. Why is PTS so important in the bigger picture of healthcare?
Yeah, that's a fantastic point to raise, because PTS isn't just about ticking boxes and following procedures. It really represents a fundamental shift in how we think about healthcare. At its core, it's about recognizing the inherent worth and dignity of each individual, their unique circumstances, their goals, their preferences, all of that matters.
So it's moving away from that one size fits all model of care to something truly personalized.
Precisely. And that personalization, it isn't just about feeling good, It's about better outcomes. When patients are actively involved in their care, when they feel heard and understood, they're more likely to adhere to treatment plans, to make those lifestyle changes, and ultimately achieve better health.
It makes sense intuitively, but do our sources back that up? Is there evidence that PTS actually leads to improve health outcomes?
There's growing evidence, yes.
Okay.
Though the research is definitely ongoing.
Yeah.
Some studies have shown that PTS can lead to better blood sugar control for diabetes patients, reduced hospital readmission rates, and even improved quality of life for people with chronic conditions.
Encouraging. And from a systemic perspective, we've already discussed how PTS aligns so well with those SUS principles of holistic care and efficient resource utilization.
Exactly. By empowering patients to take, ownership of their health, PTS can potentially reduce the burden on the healthcare system. Fewer unnecessary hospital visits, better management of chronic conditions. It all adds up.
It sounds almost idealistic.
It can be, yeah.
But I know from our earlier discussion that implementing PTS effectively, comes with its own set of challenges.
Of course.
What are some key takeaways that you would emphasize for my audience as they develop this training?
I think the biggest hurdle, and this needs to be woven throughout your training, is fostering that collaborative spirit. PTS can't work if everyone is operating in silos. Doctors, nurses, social workers, therapists, they all need to be on the same page, communicating openly, sharing decision-making.
It's about breaking down those traditional hierarchies and embracing a truly interdisciplinary approach to patient care.
Exactly. And technology can play a huge role here. We talk about Kanban, but there are so many other tools that can facilitate communication, data sharing, even patient access to their own care plans.
It's exciting to think about the possibilities, especially as technology continues to evolve.
Oh yeah.
But amidst all the innovation, it's vital to remember the human element.
Absolutely. No matter how sophisticated our tools become, healthcare will always be about about people caring for people, empathy, active listening, building trust. Those are irreplaceable skills that need to be at the heart of PTS.
Those are such important points to emphasize in the training. It's not just about learning procedures. It's about shifting mindsets and embracing that truly patient-centered approach.
Well said. And as your audience dives into the source material you've provided, they'll find even more, examples and strategies and nuances to explore. But I think we've covered the essential foundation for them to build upon.
It's been an incredible journey, and I feel like we've barely scratched the surface of what PTS can achieve. I'm leaving this conversation feeling energized and hopeful about the future of healthcare.
Me too. It's inspiring to see a model like PTS gaining traction.
Yeah.
Putting patients at the center and promoting a more holistic and compassionate approach to health and well-being.
It's a reminder that even within complex systems, real change is possible. And as your audience embarks on creating this training, I hope they carry that sense of possibility with them. PTS isn't just a set of guidelines. It's a movement towards a better future for healthcare.
Beautifully put. And to everyone listening, thank you for joining us on this deep dive. We wish you all the best as you take this knowledge and put it into action, creating a healthcare system that is more personalized, more effective, and more human.
And until next time, keep diving deep.